What prompted you to kind of come to leave that job to come to Ancestry?
So thanks, Max, for having me. I'm a really mission-driven leader, and throughout my career I've been obsessed with how technology can transform products and services so that consumers can have an enriched life. So whether it was working at Google and organizing the world's information, or it was working at Mattel to reimagine play, when the opportunity to join Ancestry came along, it was one of those that I couldn't pass up, because I actually don't really think of myself as a technologist, but I think of myself as a humanist. How do we use technology in really tangible and meaningful ways to make lives better? And I can't think of a more human company than Ancestry. It's a 30-year-old company that's focused on a mission of helping everyone discover, preserve, and share their family story. It has a massive asset base of over 20 billion records, 110 million family trees, and 13 billion ancestral connections.
Yeah, we should say a lot of people think of Ancestry as being this, as being a DNA thing, but in fact, you guys have been around for, 30 years doing these family trees.
Absolutely. It's, I think a lot of people, the consumer genomics revolution really was the first killer app of consumer genomics, and we are also the global leader in consumer genomics, but we set out to do that to help people make more discoveries in their family history research. And that really was what compelled us to scale that globally.
Okay, so the results are here. I love how polarized it is, because so on one hand we have 50% basically saying I'm never going to do this, which we'll talk about. But a pretty good percentage of you, 20%, have tried this out, which to me is surprising. But Margo, I think you were saying that's actually about the industry. It's kind of where we are today as an industry.
Yeah, we have that's a very representative of actually what's happened. We have got 20% in the U.S. of people that have taken one of these tests, and more and more millions are coming into the category all the time, because it offers a really jumpstart into that ancestral discovery, and other people are also taking them now as new applications come in areas like health, which are very meaningful to people's lives.
Okay, so let's stay on that for a second. 23andMe got in a little bit of trouble. They were one of the pioneers in the space. Basically, came in the crosshairs of the FDA for making health claims. There was kind of a weird sort of backlash period where I think the industry as a whole got a lot of bad press. I'm kind of curious what you think went wrong there, and kind of how does Ancestry see kind of balancing, the need to be responsible and make, and not overpromise what these tests can show, versus helping people better understand their their genetic makeup.
So in our view, what's really going to advance this industry is not a focus on technology or lab reports, but it's really how do we help consumers get to better health outcomes. And so for us, if we can understand actionable genetic risks that can help us get on the path to prevention in meaningful ways in a collaboration with a healthcare provider so that we can live longer, healthier lives, that's where we are really adding value and solving problems. And so that's where we think the future needs to be as we focus on this industry. So
what's the business here, though? Because this is historically these have been one-off tests, but my understanding is you guys are moving towards, Ancestry is moving towards sort of a subscription model. Why don't you just talk a little bit about that decision?
Absolutely. As I said, we didn't want to be another lab report provider. If we were going to go on this, it needed to live to the standard that we hold ourselves as we empower journeys of personal discovery to enrich lives. So we needed to get people from insights to action. And so we really focused on what consumers want most, and that was 4 things. I want actionable insights. I want access to genetic counseling services. This is new. I know I'm going to have questions. I want support. I want a seamless connection to my physician. So as I move to that action, I want to know that that doctor can understand that and take action. And last, if I'm going on this journey, I want the most comprehensive screening possible. And so for us, that was providing affordable access to next-generation sequencing technology, which provides a much more comprehensive understanding of people's genetic risks.
So next generation, what does that mean, though? Is that like the whole genome, or put that in kind of layman's?
So the original technology that was used for those first companies that entered was an array-based technology. That's also what's used for ancestral research. But as we go into the field of health, being able to look at the whole genome, not SNPs of it, but the whole gene, really transforms our ability to include more people and understand many more risks. And so for us, that's why we chose a subscription model. It really aligns our interests with the consumer. Ancestry Health Plus integrates a comprehensive family health history understanding with a comprehensive understanding of your genetic risks, looking at whole genes from next generation sequencing. And there's just more and more clinically actionable insights that we can curate and deliver to consumers. And then there are many more omics to come that help us put consumers on an empowered path to preventative health.
One of the criticisms that is often sort of leveled against this space is that the information is not as valuable as maybe people necessarily think it is. So that, your genetics, probably the simplest way to put this would be your genetics don't explain your entire health. I had the experience doing a test, not an ancestry test, but doing a test, and as you spit in the thing, you put it in the mail, you get back your results, and on one hand, it's amazing. I mean, because they're like, just based on this amount of spit, I can tell that you have blue eyes and sticky earwax, and your parents are Jews from Eastern Europe, right? And that's crazy cool, but I didn't really need to spit in the cup to figure out what my earwax is. So I'm just kind of curious how you see that kind of evolving. Like at what point will this information be like, the kind of thing where you absolutely need it, where every single person needs to do one of these or wants to do one of these?
Mm-hmm. So I would take it in two parts. I think on the ancestral side, by taking a genetic test, you are able to access a much richer set of connections and insights that you can do. We have over 15 million people in our network. That's almost 1 trillion connections. And by connecting that into our big tree, that enables you to understand not just that you're related to somebody, but who's that relative 3, 4, 5 generations back that actually makes you related. And these are really rich, contextual, and authentic experiences. And when people live today in a world where they feel increasingly disconnected, the opportunity for these real and authentic experiences that help us explore who we are. 4 in 5 Americans want to know more about their family story. Might surprise you, might seem high, but the reality is 1 in 3 cannot name all 4 grandparents. And if you ask them to actually give rich contextual information about how those people lived their lives or where they lived, people actually know even less. And so this is an innate important thing, and there's actually scientific evidence behind that. That when people understand and share their family story across generations, it makes you more confident, resilient, open to others. And also in kids, it's demonstrated to improve scholastic performance, because when kids overcome obstacles, when they've heard about how their family has overcome important things, those hardships, not just the good stuff, but the tough stuff, they build up this sense that they can overcome. On the side of health, what's really important is we are curating things that are actionable insights that lead to better outcomes, and we need to be measuring by empowering people with information, do they actually get to a better health outcome? And as a company that's really based on science and measuring impact and outcomes, that's what we're really focused on as a company. And I think by advancing that focus, we can make this really over time standard of care and everyone getting on the path to a personalized plan in collaboration with their doctor to get to better health outcomes.
Let's just broaden the conversation a little bit. I mean, as we go look forward, and there's all this excitement about personalized medicine and sort of new ways of doing genetic tests and everything. I mean, where are the areas where there's the most promise? I mean, like what types of conditions? What are the sort of health breakthroughs that people should be looking at or paying most attention to? Cancers, whatever.
All of the above.
Yeah.
I mean, I'll just give you a simple example. I mean, if I'm a 20-year-old man whose maybe father died at 42, you're probably really thinking about your diet and exercise because you're concerned about, potential heart health risk. But the reality is there's over 1 million people walking around with something called a genetic difference for familial hypercholesterolemia. Sounds like a lot of words. But actually what it means is you have a risk of highly abnormal levels of cholesterol in your blood. And it doesn't matter how much diet and exercise you do, you're going to need to be under the care of a doctor at a younger age. And if you do that, you can take statins and other things that can mitigate that risk. But if you're not aware of that, and of those over 1 million people, only 10% are aware that they're walking around with that. And so as a society, if we can make affordable, accessible, actionable insights about genetic risks and other preventative health risks available to people, we can improve health outcomes.
Yeah. Does the debate about kind of like U.S. health policy touch Ancestry? I mean, your tests are not covered by insurance right now, right? I mean, the hope would be that they would be one day. I mean, do you, as you watch sort of this, sort of play out, whether it's, Obama, sort of what happens with Obamacare or what Elizabeth Warren is talking about, is there some kind of like, does the company have a position or things that you want to see happen in this country in terms of policy?
So, our view is that we live in a time where consumers are being asked to take on more and more of the health burden. But as they walk into that physician's office where they got 12 minutes with their primary care physician, they need to know what it is they need to focus on. Otherwise, that physician is focusing on treating symptoms, right, or incidents, but they're not going to focus on treating these preventative important risks. And so if we can empower consumers with affordable information that can help them go into that doctor's office and understand those risks that they need to focus on, we can really transform not just the empowerment of that consumer, but we can also empower the physician. And as a company, we've invested as much in empowering the physician in the design of our product as we have the consumer, because both matter in getting to better health outcomes. That's why we made investments. We just made an investment. We invested $1 million donation to UpToDate, which 1.6 million doctors use that for their ongoing medical education in the office. It's that app that people have if you go into the doctor's office and they show you a picture of something. Most likely they're on UpToDate. And we're funding them to develop broadly available information for doctors on clinical actionability for genetic tests. And so
UpToDate is like Google for doctors, right? I mean,
it's the most popular tool used by doctors, and it puts it in the flow of how doctors already work today. And so it makes it much easier for them to integrate it into their practice patterns.
So this is the year ahead. Earlier this year, I love talking to you about Ancestry because the history is so interesting. I mean, started 30 years ago. I remember the software was available on CD-ROMs, went public, then was taken private. And earlier this year, we reported that Bloomberg News reported that Ancestry was talking about an IPO. I mean, can we look forward to an IPO in 2020?
So we have no plans at this time.
Do you, are you, fair enough. Let me ask you another kind of newsy question, and then we can get back to health. You also sit on the board of McDonald's. Steve Easterbrook, CEO of McDonald's, was just left the company over the weekend. For me, a really interesting story because McDonald's, this is not a case where McDonald's was performing badly or anything. It was actually performing incredibly well. From the public statements, it appears he was dismissed for engaging in a relationship, an inappropriate relationship. I'm curious if that was a hard decision at the board level, given the performance of the company.
So these are really difficult decisions when a board is faced with them. What I feel good about is we provided a thorough, thoughtful investigation of all the information on this topic, and we made a timely decision. And we hope that the decision that we've made demonstrates the board's commitment to the values that the company holds in terms of all aspects. And that doesn't matter what role you have in the company, you need to be held to the same standard.
Do you think, in general, corporations are getting better? I mean, do you feel like these conversations that have been going on for the last, 15, 20 years, or actually more recently, like last 2 years, have made a difference and are changing the way, big companies and boards look at executive behavior?
So I think, every board has rigorous processes to make sure that they have clear policies and investigative reviews. And I think it's incumbent on every board to ensure that they're making those decisions and upholding the values of the company.
Yeah. So when you look at the future, I mean, I'm kind of, I'd love to ask, what disease are we going to cure in the year ahead? But I mean, I'm really interested in, as we get to a higher percentage of people who are taking these tests, where if we get to a world where everyone is getting their genome sequenced, I mean, how does that change? I'm kind of curious how that changes medicine, but I'm also, that people talk about that a lot. I mean, basically it would mean, I guess, we'd live longer or something. How does it change business? I mean, does it destroy the global the U.S. healthcare industry, or like how's that going to shift kind of like how care is given and how money is made in this industry?
So, the way we see it is that today in the health system, 90% of the cost is on 10% of the people. But what we all really want to do is live longer, healthier lives. And if there's important insights and information that can help us take preventative steps, we'd much rather do that than ending up with disease. And the vast majority of many of these diseases will be understood over the next 5 to 10 years. We will have genetic, familial, and other omics insights that will enable us to hopefully get on the path to prevention and mitigate, avoid, right, or much better manage the outcomes for the system. And hopefully that will enable people to live a higher quality, longer life, and to be able to reduce costs in the system. So I do think that there's an enormous opportunity with population screening done well, focus on actionable insights to truly make a big difference 10 to 20 years from now.